Hi everyone, thank you for coming to my video. My name is Daniela. If you watched my last video, you would know that I just graduated nursing school last month. And my last video was about what I wish I would have known before I started nursing school. So just like little tips about everything in general. This video I wanted to make more about nursing school clinicals specifically. So clinicals are a huge part of nursing school. It's where you spend a lot of your time if you're not studying to get your practice and to learn things that are not going to be in the book. So I just wanted to give you a few tips that I wish that I would have known before I started clinical. So my first tip for nursing school clinicals is that not every nurse is happy that you are there. And this is so true, and it's kind of to be expected, but still kind of hurts a little bit if you don't expect it. So I had my last semester I had capstone, and I was on a mother-baby floor, which is really what I'm passionate about when it comes to nursing, moms and babies, just anything women's health. That's my favorite. And I was on the mother baby floor, and my preceptor, I just am so thankful for her. She is such a good teacher. I swear she was put on this earth to be a nurse and to teach students how to be a nurse. She was just amazing and so passionate about her job that she made me just want to learn. She never made me feel stupid. She always like eased me into everything to where I didn't feel uncomfortable, and I wasn't ever scared to do anything. She would demonstrate things first if I needed it, and she was just amazing. She really finished up my nursing school in the best way possible, and I'm so thankful because I know a lot of people don't get as lucky with their capstone placements, and I'm just so happy that I got to have her. But on the other hand, you will also have nurses that do not want you there, and it's just a combination of things makes that happen. If they're burnt out, if they have a lot of patients or a lot like a high acuity, they're having troubles with other people on the floor. If there's things happening at home, you never really know why someone's having a bad day. Some people honestly realize, like, I was not meant to be a nurse, and now I'm here after going to school, which I can imagine sucks. I hope that doesn't happen to me. But that's really hard to be in a clinical setting when you have somebody that doesn't want you there. But, you kind of just have to put on a thick skin and just get through it. A lot of them, like eat your young is definitely real, but I mean, until that goes away, you're gonna have to deal with it, and you just have to get through it and be confident in yourself, which I'll get to in a few more points. But just do your best. That's all you can do. And you're probably not going to see that nurse again unless for some reason you work there. Don't really confront her unless if it's serious. Unless if it's serious, but just kind of let it roll off your shoulders. You're going to be there however many hours. Just get it done. My second point is to be confident. Let me put this in here. This does not mean doing things that you are not allowed to do yet or that you don't feel comfortable. If anybody from my nursing program ever watches this, which I doubt it, but you never know, they will remember first semester when people were doing things that we definitely weren't allowed to be doing yet, and needless to say, those people didn't last past first semester. So what I mean by be confident is when you have a skill that you're doing, if you are checked off to do it, if you know how to do it, be confident in that. Don't let, a nurse standing next to you or, something, don't let that shake you. Just know that I've done this before. I can do it now. It's on a patient. It's not on a mannequin. That's okay. You have to do it sometime. But do the skills that you know well. Your professors, hopefully, aren't going to let you go into a clinical situation if you're going to be a harm to patients. So be confident in yourself. Do what you know that you can do and do it well. That last point leads me into just be honest. If you don't know how to do something and your nurse asks you to go do it, don't do it, because you could hurt somebody and you could just make yourself look really freaking stupid, even more stupid than you would have looked if, you know, you had just said, I don't know how to do that yet. For example, I mentioned this in the last video. I was in an accelerated program, so things are just like zoom, things get done quickly. You learn things kind of out of order, I felt. And sometimes they expect you to just learn things on your own. And I didn't know how to even empty a catheter bag. Like, I had just never emptied someone's urine before. And the nurse at my first clinical said, or it wasn't my first at that point, but she said, can you go empty that patient's bag? And I was like, I don't know how. And she's like, you just told me that you guys practiced inserting NG tubes this week and you don't know how to empty a catheter bag? That's ridiculous. Which, she was right. Didn't really need the tone. Kind of unnecessary, but you know what? I was like, well, you can teach me if you want, and I'll be happy to do it for you, but yeah, I'm not going to mess it up. So she didn't teach me, and she just kind of got pissed, but that's fine. You know, what if I would have gone in there? Obviously, I wouldn't have done this, but I could have, yanked something out that wasn't supposed to be taken out, or something could have gone wrong, and let's say that would have happened with a more serious situation, like someone asks you to program a pump and start some med that you have never seen, and you have never used a pump like that before, or you've never used a pump. You just need to be honest and say, I've never done that. And it's way better than making a mistake by trying to just say you know something and lying. Not worth it. My next point is to get in and get out. I might talk about this situation in a different video sometime, I don't know. But I had a professor that, she just made me so nervous to go to clinical. I swear, TMI, but whatever. I developed IBS from having to go to clinical with her because she made me so nervous. She made me cry in front of patients before, and it was just a horrible experience having clinical with her. I swear I have PTSD from it. But, you know, she's truly not a bad person. It's just her way of teaching, which I would never teach like that, but whatever, made it through. But that's my point, as I made it through it. I still went to my clinical. I didn't go to my, director saying, she's mean. Okay, people are mean. You're gonna have mean bosses in the future. You're gonna have mean patients. You have to get through it. I almost didn't, but I did. So my point is, go to your clinical, be on time, keep focus, and if someone's kind of bullying you, not that she was really bullying me, because it definitely was not targeted just at me. But anyway, if someone is kind of bullying you, just know you only have however many times with that clinical. Just get it done and get out, and it'll be easier than if you made a big deal out of it. So my next point is something that I think a lot of schools tell their students before they even go into clinical, but it's to not develop bad habits from nurses. And when you start nursing school, you're doing everything by the book because that's what you know. And that's what, you should strive to continue to do, because it's only going to help you in your future career, and it's only going to help your patients. And, I would go into clinicals and you would have nurses not wearing gloves when they would do injections, or not scrubbing the hub before they do, an IV push, something like that. Or they'd leave their computer wide open and everyone could see it, or they would cuss a lot while sitting at the nursing station. And while you're in an environment like that, it's really easy to develop those habits, because you're just hanging out, it's cool, these nurses are cool, we're chill. But no, don't do that, because for example, the nurses that were all cussing at the nursing station, I was sitting right there, and patients ended up complaining that they could hear the nurses cussing in the room. And, cussing to me isn't a big deal, but in the workplace it is. So it's just not worth it. Don't develop habits like that, because it could cost you your license someday. My next point's kind of a no-brainer, but it helped me a lot through nursing school, and it's to stay at your friends' houses. Having enough sleep, which you will never get, but having kind of enough is really important. And I would always live an hour to an hour and a half away from our clinicals. And sometimes my friends would live, 15 minutes from the hospital, and I would stay with them, and it would just make things so much easier. Like, yeah, it kind of sucks not being in your own bed or with your boyfriend or your husband or whoever, but you get the job done, you get a little more sleep, you're closer to the hospital, so you're not as nervous. And for me, I loved my friends that I stayed with, and I ended up loving their families and their pets. And it made a home for me when I had just moved from home and started nursing school. It made a second home for me to where I didn't feel so isolated in this new place. So I highly recommend staying with your friends, because there's just a lot of good can come out of it, and it's totally worth it. My next point is to be prepared. So obviously when you come to clinical, you're going to have your stethoscope, pens, whatever, but be even more prepared than that. So stethoscope, pens, have a pen light, scissors, tape, what else? A marker. And if you can keep like alcohol pads, any like little thing that you can think of, you're probably gonna need it sometime, and your nurse is probably gonna say, do you have this? And I've been there plenty of times where I've said no. So have it with you. I've had like blue pens before when someone's needed to start blood, and they're like, we have to fill out this document, it has to be black. And I'm like, oh, cool. So I look pretty dumb then. Or a nurse has needed to write, on her board, and I haven't had a marker available. So I'm just telling you that from experience. Be prepared. Also, like for when we had our peds clinical, my friends all had like really funny badge reels, and I just would have never thought of that. But the peds patients love them. If you're trying to give a peds patient a shot or make them take a medicine that's kind of gross, or something like that, if they're playing with like a funny pen or like a funny badge reel, it distracts them, and it makes them enjoy you and trust you, and just makes the process a lot easier. So this point is so important, and I feel like anyone watching this video is probably around my age. I'm about to turn 24, and so we're so used to being on our phones, and a lot of the nurses that you're gonna have your clinical with are used to being on their phones too. But don't get in that habit, not because it's like such a bad habit, even though it kind of is, but for example, my preceptor at my capstone, if we were slow, or if she had a little boy, so she was checking her phone a lot, I would check my phone every time she would check her phone, and it would end up I would just keep scrolling and only stay focused on my phone. I was only paying attention to my phone, and then all of a sudden we would need to go do something, and I had to quick shut my phone, or I wasn't paying attention, or she was charting and I was on my phone and I wouldn't even realize she was charting. Just little things like that. Even though the nurse is doing it, that's her job. You're there. She can kind of do it, he or she can kind of do whatever they want, you know what I mean? But you're there to learn. If that means you're not going to be on your phone all day, then that's what that means. And, I never got in trouble or anything for being on my phone, but I just feel like it wasn't a good look how much I was on my phone, and that was just because I was comfortable. So sometimes you don't realize the habits that you're developing while you are just comfortable. So just keep your phone away, and only check it if you really need to, you're at lunch, and if you need to look something up, something like that. So those are pretty much all my tips for nursing school clinicals. I might touch on other subjects in another video if this gets any views or anything like that. But go ahead and like it, and thank you for watching.